Hello friends, today we'll see what are the new ICT 10 code changes which are effective from 1st of October to 2024 to next 2025. So we'll see what are the new ICT 10 codes added or the changes happening in future from 1st of October. So there are many changes in Neoplasm. You will see a lot of Neoplasm new codes, and these several codes are converted to parent codes. Old codes which were there, they are converted into parent codes and are expanded with fifth character A to indicate cancer in remission. So remission means nothing, the sign and symptoms of a cancer are reduced. In remission phase, the signs and symptoms of any cancer or neoplasm are reduced or decreased. So that is called remission phase. So it can be partial or complete. See, if the remission is more than like 5 years, some doctors or physicians says the cancer is cured. It can last for months, years, or rest of your life. There is no time specific time period for remission. So we have separate ICD-10 codes for a neoplasm in remission this year. So here is some examples are there: C81.1a, C81.2a, nodular sclerosis, Hodgkin lymphoma in remission, mixed cellularity Hodgkin lymphoma in remission. So these are only few, but there are many ICD-10 codes in neoplasm which are in remission, which are having new codes in remission. So all the list I will share in a link which will be given in the video description, where you can find all those list of new codes in neoplasm. Here we will just check out some of the examples here. So next, hypoglycemia and obesity new codes are there. So here in under E10, that is type 1 diabetes, there are new codes for pre-sympathetic diagnosis. So there are 3 codes actually here: E10A0, E10A1, E10A2. So for type 1 diabetes with pre-symptomatic unspecified, we have 0. Type 1 diabetes pre-symptomatic stage 1, we have E10A1, and type 1 diabetes pre-symptomatic stage 2. So these 3 codes are there for type 1 diabetes new codes. Then we have hypoglycemia level 2 and level 3 new codes, and for obesity class 1 we have new codes. And for disorder of citrate metabolism E7882, we have new codes E74820, E74829. So these are the new codes are added for hypoglycemia and obesity section. These all will be effective from 1st of October 2024. So here you can see the stage 1 and stage 2 for type 1 diabetes. Stage 1 is described the multiple confirmed isolated and autoantibodies with normal glycemia in 2025 ICD-10 tabular index. And stage 2 is described as the multiple confirmed isolated autoimmunity with this glycemia in 2024 tabular index. So this is the difference between stage 1 and stage 2 new codes. Next is mental health disorder. We have new codes. See, under F50 category we have eating disorder. There are several new codes for anorexia nervosa restriction type. So here you can see there is a restricted type is mild, we have a separate code. Then there is an extreme, so we have a separate code. Then again F5021 bulimia nervosa mild, we have a separate code. F2814 being eating disorder in remission. Then for pica in adults we have F5083 rumination disorder in adults, we have F50.84. So all of these new codes added this year in ICD-10 code book, which will be effective from 1st of October. Again we have digestive system new codes. These are based on whether the condition is simple or complex or initial, persistent or recurrent. We have separate new codes for anal fistula and rectal fistula. So here you can see for anal fistula simple we have K60.311. If it's complex we have K60.32, where we have Again, rectal fistula, you have simple recurrent, which is K60.413. Again, it is complex and persistent, means we have K60.422. The anorectal fistula, we have again based on simple or complex, different ICD content codes, new codes for new CPT code book, CPT not ICD-10 code book. Then again ICD-10 code for musculoskeletal system. We have here for unspecified synovitis and tenosynovitis, we have only one code previously, but now we have based on location like left ankle, right ankle, foot, we have a specific code M65.971. we have a separate code for right ankle and foot, and we have for left ankle and foot we have a separate code M65.972. Similarly, again we have synovitis, tenosynovitis for other specified and multiple site. We have a specified code M6598 for other site and M65.99 for multiple site.